I would like to tell you the story of a patient that arrived from an African country to Germany in order to seek asylum here. And the patient presented with a skin disease that led to sensitivity loss and resulting injuries like burns from it. He was not diagnosed in Germany and he did not receive any treatment. Because of family and friends in Netherlands, he went then to Netherlands, where he was diagnosed as a leprosy case, and he started on treatment. Then, because of the Dublin Agreement, he was sent back to Germany, where he lived in a small town in an asylum camp, and there he went to the authorities in order to continue his treatment. And the people there, instead of giving him the treatment and continuing it, were like scared because of the diagnosis of leprosy and started a big isolation and information campaign. They started to call us almost daily here in order to see if this patient could have infected staff and other people in the small town, and there was a big stigma attached to the disease. This patient, he was already on treatment for 3 months, so there was no risk of transmission. We also talked to the authorities several times to tell them that there was no risk of infection, but they still continued to call us very often. We then hospitalized the patient here, started treatment again, and tried to organize that he could move to a camp near Würzburg in order to keep him on treatment. That was a very difficult task with a lot of bureaucracy included, and at the end we had to discharge him with no solution to this problem. So he went back to his town with his medication, and well, now it is on us to call again and to see whether he still receives his medication, whether there is a follow-up, and the authorities told us that there was at least no possibility in the next months, like 2 or 3 months, to transfer him to Würzburg. And this is also a good example to see how the focus at the moment of healthcare for asylum seekers in Germany is exclusively almost based on preventing transmission to German society and not on individual healthcare. It is much more work to achieve equity for asylum seekers and refugees, but it is worth it, and we should go this extra mile to achieve it and to cure and help them.